Before entering the room, I would make sure to check the electronic health record. I would also make sure to check if there was any new lab orders or any lab orders that I would need to check. And I would check the outside of the door to make sure there is no flags or anything like that, such as NPO or any fall risk or something like that. So I'm gonna enter the room. Hi, my name's Alexa and I'm gonna be your nurse today. Can you tell me your name and date of birth?
Lizzie Rathbun, 12/14/2005.
Perfect. I'm gonna check that. Lizzie. Perfect. Yeah. So what brings you in today, Lizzie?
I'm having some pain in my shoulder.
Your shoulder, and where does it hurt exactly?
Like right around here.
Okay, yeah. And how does that pain feel?
It's like
Throbbing,
sharp, shooting.
Sharp and shooting? Yeah, okay. And what were you doing when you experienced this pain?
I was like throwing a ball for my dog and I think I really like threw it too hard.
Okay, yeah. And does anything make that pain feel better?
When I'm just letting it lay, it feels okay.
Yeah, anything make it worse at all?
Definitely when I'm moving it.
Okay, yeah. And then on a scale of 0 to 10 using this, how would you rate your pain? 0 the worst, 10 the worst pain you've ever felt.
Okay, I would say a 4.
A 4, yeah. Okay, well, I'm sorry you're feeling that pain. And one more question. When you were, like, how long have you been experiencing this pain?
It started around 4 days ago.
Okay, yeah. Well, I'm sorry you're feeling that pain, but I'm going to try to help you. But first, I'm just going to take some vitals and do some other assessments, if that's okay.
Yeah.
Okay. I'm going to check your temperature first temporally using the temporal thermometer. Perfect, 98.2, that's a great temperature. I'm going to put on this pulse ox. See your O2 stat. You can just relax. All right, 99, that's a great pulse. That's a great O2 stat. And now I'm gonna check your apical pulse.
Okay.
And I'm also gonna do some respirations as well. So I'm just gonna have you sit here, relax, just breathe normally, okay? All right, perfect. So when I was listening to that apical pulse, I got 86 beats per minute, which is perfect. I also took your respirations at that time, and I did it for 30 seconds, and I got 8, and I multiplied that by 2 to get 16. So that's great. Now I'm gonna take your blood pressure. All right. First gonna measure the cuff to make sure it's tightened properly. Perfect, that's gonna fit, and then I'm just gonna put this on your arm, make sure it's nice and fitted. Does that feel okay?
Yeah.
Yeah. I'm gonna estimate your systolic blood pressure. So I'm gonna palpate that brachial artery. Go to when I don't feel it anymore. Alright, so I don't feel it around 120. So I'm going to pump it up to about 150, let all the pressure get out. Alright. Just relax your arm, okay?
Okay.
All right, I got 112/78, which is a great blood pressure. I'm gonna take that off. All right, and then do you remember what my name was?
Alexa.
Do you know where we're at?
The hospital.
And do you know what the date is?
December 11th, 2025.
Perfect, yeah. So my patient is alert and oriented to person, place, and time. And if she wasn't alert or orientated, I would use the Glasgow Coma scale, but I do not need to use that for my patient. Now I'm just gonna check my patient's pupil size. All right, they look about a 5, which is great. Now I'm just gonna have you look at me, okay? I'm just gonna shine this light in your eyes. All right, my patient's pupils are reactive, responsive to light, which is great, and they're equal. And now looking at my patient's skin, it looks healthy, moisturized, a tannish pinkish color. She has good body alignment. She's sitting up straight, no foul odors coming from her, which tells me that she has good patient hygiene. She looks relaxed. She has no facial droop. She's able to swallow, which is great as well. We're able to talk back and forth to each other, so she has clear speech. I'm able to understand her. She's also able to understand me, being like we're able to have a conversation without a barrier, which is great. And now I'm just gonna have you squeeze my hands. I'm gonna have you push against my hands, pull against my hands. Perfect. Now I'm just gonna do it with your feet, okay? Pull against my hands, push, and then try to lift your feet off the bed if you can. Perfect, yeah. My patient's muscle strength is good. I would give that about a 5+. Now, can you also wiggle your fingers and toes for me? Perfect. You have any numbness or tingling with that?
No.
Perfect. So my patient has great sensation to her fingers, toes. And now I'm going to ask you a couple questions. So are you having a cough at all?
No.
Perfect. So if my patient did have a cough, I would ask about the frequency, how long it's been lasting, if there was any mucus, what color it was, and how much. And if my patient would have oxygen or like a nasal cannula, I would assess the fit, make sure the flow rate is good, but that is not needed for my patient. And if my patient was ordered a deep breathing exercises, I would ask how to use an teach you how to use an incentive spirometer, and also teach you like the importance of taking deep breaths to help strengthen those muscles. So now I'm gonna listen to your lungs, okay? I'm gonna listen on the front first, and I'm just gonna have you sit up, just take deep breaths in through your nose, out through your mouth, okay?
Okay.
All right. All right, I'm gonna listen to your back now, okay? Can you just turn a little bit so I can do that? Perfect. Perfect. Okay, you can sit back. Your lung sounds were clear. There were no adventitious sounds such as wheezing or crackles, which is great. And now I'm also going to listen to your heart, okay?
Okay.
So I'm going to listen with the diaphragm first, the aortic, pulmonic, Orbs, tricuspid, and mitral. Perfect. Now I'm going to auscultate using the bell, okay? Aortic, pulmonic, herbs, tricuspid, and mitral. Perfect. So your lung sounds were great. They were strong, regular, no abnormal sounds, no murmurs or anything like that. I did hear S1 loudest at the apex and S2 loudest at the base of the heart, which was great. And now I'm just going to check your capillary refill, okay? So I'm just going to have you put out your fingers like that. I'm going to squeeze your fingers a little bit. Perfect. Less than 3 seconds. That was great. I'm going to do it to your toes, okay? Perfect. Less than 3 seconds as well, which is great. Now I'm going to uncover your legs a little bit, okay?
Okay.
I'm going to check for any swelling. So I'm just going to move your legs a little. Checking the ankles and the feet as well. There's no swelling, no pitting edema as well. All right, now I'm going to check your dorsalis pedis pulse. Perfect. Equal bilateral, I'll give that about a 2+. Posterior tibial pulse. Equal bilateral, I would also give that a 2+. Cover your legs back up. And then I'm going to check your radial pulse, okay? All right, equal bilateral, I would also give that a 2+. Now, if my patient had any TED hose, SCDs, foot pumps, I always make sure those are fitting properly, make sure they were on to prevent deep vein thrombosis. And now I am going to check your skin, okay? So it looks like your skin color is good, tan, moisturized, no lesions, no skin breakdown, nothing like that. Now I'm going to check my patient's IV, and she doesn't have one, but if my patient did have an IV, I would check like the site around it, make sure there was no redness or swelling, but she doesn't have that, which is good. Now I am going to assess the skin temperature, so I'm just going to feel your skin, okay? I'm going to uncover your legs. That's okay.
Yep.
Okay, I'm just going to feel with the back of my hands. All right, your skin is warm and equal bilaterally, which is great. And if my patient was at risk for skin breakdown, I would use the Braden scale, but you're not at risk for skin breakdown because you're hydrated, moisturized, your skin looks great. If my patient had any reduction surfaces for like pressure wounds or anything, I would make sure that the pressure is great, that they were placed in the right areas. And also if my patient was on bed rest, I would make sure the head of the bed is elevated at the proper height for her, that she's comfortable. I would also make sure to implement like a turning schedule, but that is not needed for you. And now I'm just gonna have you lay down, okay, if that's okay with you. I'm gonna look at your stomach. I'm gonna assess your abdomen. So looking at it, it's about flat, it's contoured, it's great, it's symmetrical. And now I'm just gonna listen, okay?
Okay.
I'm gonna listen at the right lower quadrant, and I'm gonna move clockwise. All right. All right, my patient's bowel sounds are reactive in all 4 quadrants, which is great. And are you feeling nauseous at all?
No.
Okay, well, are you tolerating your diet well?
Yeah, I would say.
Yeah, and I would keep your diet the same because it looks like you're at a healthy weight. You look great, which is awesome. And now, when was the last time you made a bowel movement?
Last night.
Last night? And how often do you make a bowel movement?
At least like once every day.
Okay, yeah, and what color is your bowel movement normally?
It's usually brown.
Okay, yeah, and then using this scale here, how would you say your bowel movement looks like?
I would say type 4.
Perfect, yeah, that's a perfect bowel movement. And if my patient had like a Foley or anything like that, I would check to make sure it is lower than her, taped to her leg, but she doesn't have a Foley catheter or anything like that. Now on like that same note, how often are you urinating?
Multiple times a day.
Yeah, and like how are you urinating, like a normal amount, you would say, not too much?
Yeah, like
Yeah.
like a normal amount.
Great, yeah, and then what color is your urine?
Clear, yellow, yeah.
Okay, yeah, any foul odor or anything?
No.
Smell to it?
No.
Any cloudiness?
Nope.
Any pain with urination?
Nope.
Perfect, so I can roll out the signs and symptoms of a UTI. If my patient did have urinary retention, I would use a bladder scan, but it looks like you don't have anything like that. And then are you able to like walk normally, exercise normally?
Yeah, I exercise most days of the week.
Perfect, that's awesome. And then do you use any like assistive devices?
Nope.
Okay, yeah. And then if my patient was for fall risk, which she's not, but if she was, I would use the Moore's scale and I would assess for that fall risk. And I would also check to see what medication she's on, because some medications can lead to more of a fall risk or like your level of consciousness and stuff like that. But yeah, are you comfortable?
Yeah.
Yeah, okay, so I'm going to give you your call light. I'm going to put that right there. I'm going to make sure the top side rails are up. And if you need me, just press that call light. The bed is locked in its position. I reset any bed alarms. All right, so if you need me, just press that call button, but I'll be back to check on you, okay? Thanks for your
Thank
cooperation.
you.
And I'm just going to grab some hand sanitizer.